Have you ever felt ashamed to admit that you need more, but feel less and less? Compared your current reality to what you used to feel and stayed silent, angry at yourself? The truth is harsh. It's not just time stealing your vitality. It's invisible habits, easy pleasures, and dangerous shortcuts quietly draining your strength. In this video, you'll uncover the 9 hidden mistakes sabotaging your sexual, emotional, and even spiritual energy after 60. What starts as convenience or relief becomes a trap, and most men don't realize it until they've lost everything: pleasure, connection, desire, even self-worth. But there's still time, if you act now. Men who thrive in their later years aren't the strongest. They're the ones who stop lying to themselves. Are you ready to reclaim control, reconnect with your power, and prove you're not done yet? Then watch until the end, because this might be the turning point you didn't know you needed. Mistake number 1. Digital overstimulation syndrome. This conversation makes even my most confident patients uncomfortable because it strikes at the core of modern masculine privacy. Men lower their voices, avoid eye contact, and sometimes can't even say the words directly. "Doctor, nothing works like it used to. I need stronger and stronger stimulation just to feel anything at all." They assume this represents natural decline. They're wrong. What's actually happening is catastrophic neurological rewiring that becomes irreversible if not addressed immediately. After 60, your dopamine receptors, the brain's pleasure and motivation centers, undergo structural changes. They become hypersensitive to overstimulation while simultaneously requiring triple the recovery time of younger brains. This isn't weakness or moral failure. It's documented neuroscience. Modern digital content delivers dopamine spikes 500 times more intense than your aging brain can process safely. Every image, every scene change, every moment of novelty floods your neural pathways with chemicals they cannot clear fast enough. Your brain responds by permanently reducing receptor sensitivity, like turning down a volume dial that can never be turned back up. Eventually, real human touch feels like nothing. Partner intimacy becomes impossible. Even intense digital content stops producing any response. I've seen men cry in my office when they realize what they've lost. But here's what devastates me most as a physician. The emotional disconnection that follows is often more damaging than the physical changes. Men report feeling completely detached from their own bodies, unable to experience genuine pleasure or emotional connection. They exist in a gray zone between numbness and frustration, not broken enough to seek help, but not alive enough to feel truly human. Mistake number 2. The toilet trap. When men admit this habit, they usually laugh nervously, as if acknowledging something shameful but insignificant. "It's just convenient, doctor. Private. Quick. No cleanup needed." I understand the practical reasoning. Bathrooms offer privacy and simplicity. But this convenience is destroying your pelvic floor and causing permanent nerve damage you won't notice until it's too late. Toilet positioning compresses critical arteries that supply blood to your prostate and penis. The hard porcelain edge creates pressure points against pudendal nerves that control erection quality and sensation. In younger men, blood flow compensates. After 60, compensation mechanisms fail. I've documented cases where this single habit caused complete erectile dysfunction within 2 years. Men develop chronic pelvic pain syndrome, persistent prostate inflammation, and permanent numbness that no medication can reverse. The psychological conditioning is equally destructive. When intimate moments happen hurriedly on cold porcelain, your nervous system never fully relaxes. It remains in sympathetic activation, fight or flight mode. This trains your body to associate arousal with stress rather than pleasure, leading to performance anxiety that becomes self-fulfilling prophecy. The solution requires conscious repositioning. Your pelvic region needs proper support and unrestricted blood flow. Lying down, reclining comfortably, or standing allows natural circulation. These adjustments preserve the delicate structures that maintain sexual function well into your 80s. Mistake number 3. The speed trap. Modern life demands efficiency, and many men apply this mentality everywhere, including intimate moments. "I don't have time, doctor. I just need quick relief." This efficiency mindset is programming your nervous system for failure. When you rush, your body releases cortisol and adrenaline instead of oxytocin and endorphins. You're literally training your brain to interpret arousal as stress. Speed eliminates neuroplasticity, your brain's ability to maintain and create new pleasure pathways. Rushed stimulation bypasses the parasympathetic nervous system entirely, preventing the restorative processes that should occur during intimate moments. I've measured hormone levels in men who rush versus those who take time. The differences are shocking. Rushed men show testosterone drops of 40%, chronic elevation of inflammatory markers, and stress hormones that remain elevated for hours afterward. They feel exhausted rather than energized, depressed rather than satisfied. Slowing down isn't indulgence, it's medical necessity. Extended, mindful engagement allows blood vessels to fully dilate, nerve endings to activate completely, and healing hormones to circulate throughout your system. Mistake number 4. The forgotten foundation. Most men don't know they have pelvic floor muscles until they stop working. These hidden muscles control everything: erection angle, ejaculatory force, bladder control, and prostate positioning. After 60, they determine whether you maintain function or lose it entirely. I routinely see men who've unconsciously clenched these muscles during arousal for decades, causing chronic tension that restricts blood flow and damages nerve endings. Others have let them atrophy completely, leading to erectile dysfunction and incontinence. The solution involves conscious engagement and release. Contract these muscles gently, as if stopping urination midstream. Hold for 3 seconds, then fully release for 6 seconds. This simple pattern, repeated daily, can restore erectile function better than any medication. Mistake number 5. The frequency fallacy. Am I doing it too much, doctor? Or not enough? This question reveals deep confusion about what actually supports prostate health after 60. Some men engage daily out of habit rather than desire. Depleting testosterone reserves their aging bodies cannot replenish quickly enough. They experience chronic fatigue, irritability, and diminished pleasure that worsens over time. Others abstain completely, believing this preserves vitality. But extended abstinence causes tissue atrophy, reduced blood flow, and nerve dormancy that makes arousal increasingly difficult. The optimal frequency is individual, but follows patterns. Most men over 60 benefit from engagement every 4 to 7 days, allowing hormone replenishment while maintaining tissue health. Quality matters more than quantity. Mistake number 6. The pressure problem. As sensitivity naturally decreases, many men compensate with aggressive stimulation. This instinct destroys remaining nerve endings permanently. Penis tissue contains specialized nerve receptors that respond to gentle warmth and rhythm, not force. Excessive pressure causes micro tears in nerve sheaths, scar tissue formation, and permanent sensitivity loss. I've seen men develop Peyronie's disease, painful curvature caused by scar tissue, from this single habit. The restoration requires counterintuitive gentleness, light touch, slower movements, and patience allow nerves to regenerate sensitivity. Men who adopt this approach often recover sensation they thought was permanently lost. Mistake number 7. The emotional void. This mistake doesn't appear on medical tests, but affects more men than all physical issues combined. Intimate moments become mechanical, devoid of emotional presence or intention. Without emotional engagement, your body doesn't release oxytocin, the bonding hormone that creates satisfaction. Dopamine remains flat. Serotonin doesn't activate. You go through motions without receiving benefits. Men describe feeling empty, depleted, or anxious afterward. They've removed the human element from a fundamentally human experience. Restoration requires presence, intention, and self-compassion. Mistake number 8. The supplement ignorance. After 60, your body requires specific nutrients for sexual function that diet alone cannot provide. Zinc maintains testosterone production. L-arginine enhances blood flow. Vitamin D3 supports nerve function. Magnesium enables muscle relaxation. Without these, cellular function deteriorates regardless of other habits. I've seen remarkable transformations when men address nutritional deficiencies. Not through random supplements, but targeted support based on blood work and symptoms. This isn't optional enhancement, it's foundational requirement. Mistake number 9. The hydration crisis. Dehydration after 60 affects sexual function more than most realize. Blood becomes viscous, reducing flow to extremities. Nerve conduction slows. Muscle tissue loses elasticity. Most men over 60 are chronically dehydrated without knowing it. Proper hydration means consuming half your body weight in ounces of water daily, spread throughout the day. This simple change improves erectile function within weeks, but hydration extends beyond water. Electrolyte balance becomes critical after 60. Sodium, potassium, and magnesium regulate nerve firing and muscle contraction. Without proper balance, sexual function suffers regardless of other interventions. I recommend adding trace mineral drops to water or consuming coconut water daily. This maintains cellular hydration that pure water alone cannot achieve. The aging advantage. Here's what younger men don't understand. Sexual function after 60 can actually improve when approached correctly. You possess patience, emotional maturity, and self-awareness unavailable in youth. These advantages, combined with proper technique, create experiences superior to anything possible at 30. The men who thrive aren't trying to recapture youth. They're discovering what maturity offers: deeper sensation, emotional connection, and satisfaction that transcends physical release. The integration protocol, implementing these corrections simultaneously, creates synergistic improvement. Start with hydration and positioning. Add nutritional support and pelvic floor exercises. Reduce digital stimulation while increasing emotional presence. Slow everything down. Within weeks, men report renewed sensitivity. Within months, erectile function improves. Within a year, many achieve sexual satisfaction exceeding their younger years. The cellular restoration secret recent research reveals that sexual activity after 60 triggers cellular regeneration processes unique to this life stage. Telomerase activation, stem cell production, and growth hormone release all increase with proper intimate engagement. This means intimate moments aren't just maintaining function, they're actively reversing aging at the cellular level, but only when performed correctly, without the 9 mistakes we've discussed. The partner dynamic. Many men over 60 navigate intimate changes alone, assuming partners wouldn't understand or feeling shame about discussing challenges. This isolation amplifies problems. Open communication with partners, when applicable, transforms outcomes. Partners often provide emotional support and practical assistance that accelerates improvement. They've noticed changes too, and usually feel relief when discussions begin. The medical integration. These behavioral corrections complement medical interventions. Medications work better when combined with proper technique. Natural function often returns, reducing or eliminating pharmaceutical dependence. However, certain symptoms require immediate medical attention. Sudden complete dysfunction, pain during arousal, blood in semen, or urinary retention. These indicate conditions requiring professional intervention. The progression timeline. Week 1 to 2, increased awareness and mindfulness. Week 3 to 4, improved hydration effects and positioning comfort. Month 2, noticeable sensitivity improvements. Month 3, enhanced erectile quality. Month 6, significant restoration of function. Year 1, optimal achievable function for your age. This timeline assumes consistent application without expecting overnight miracles. Patience becomes your greatest asset. The psychological transformation. Beyond physical improvements, men report profound psychological changes. Confidence returns, depression lifts, anxiety decreases, sleep improves, energy increases throughout the day. These changes reflect normalized hormone production and nervous system regulation. Sexual health directly impacts overall well-being in ways most men never realized. The social silence society doesn't discuss these issues, leaving men to struggle alone. This silence causes unnecessary suffering. Men assume they're uniquely broken when actually they're experiencing common, correctable problems. Breaking this silence through education and open discussion removes shame and accelerates healing. You're not alone in these challenges, and solutions exist. The prevention principle. Men in their 50s reading this can prevent problems before they manifest. Early implementation of correct techniques maintains function indefinitely. Prevention requires far less effort than correction. The legacy perspective. Your sexual health affects more than personal satisfaction. It influences how you show up for partners, family, and community. A man comfortable with his sexuality radiates confidence that positively impacts everyone around him. Maintaining vitality isn't selfish, it's responsible. You owe yourself and loved ones the effort required to remain fully present and engaged throughout your later years. Final message. If you remember nothing else, remember this. Your body hasn't betrayed you. It's been patiently waiting for you to understand its evolved needs. Every challenge you're experiencing has a solution when approached with knowledge, patience, and self-compassion. These 9 mistakes aren't character flaws or signs of weakness. They're results of inadequate education and societal silence around mature male sexuality. Now, you know better. Knowledge combined with consistent application transforms everything. Your sexual health remains interconnected with overall vitality. When intimate moments occur with awareness, respect, and proper technique, they support every system in your body while reinforcing psychological well-being and personal dignity. Small adjustments practiced consistently create remarkable improvements. Gentler approach, conscious positioning, patient pacing, nutritional support, emotional presence, proper hydration. Each change signals your nervous system that it's valued and supported. If you've noticed declining function, don't accept it as inevitable. Your body simply requires different care than before. Learn its current language. Practice patience. Celebrate small improvements. They accumulate into transformation. Men who thrive through aging aren't denying reality or chasing youth. They're embracing evolution, remaining curious, and treating their bodies with earned respect and wisdom. This content is for general informational purposes only. It does not replace professional medical evaluation. If you have questions or symptoms, consult your healthcare specialist.